The morning sun peeked through the windows of Metropolitan General Hospital as Nurse Thompson walked through the sliding doors, her shoulders back and head held high despite the weight of her 15 years of experience seeming heavier than usual lately. The familiar scent of coffee and sanitizer filled the air as she made her way to the nurse's station, exchanging warm smiles with the overnight staff preparing to head home. She'd earned her stripes in this hospital, working her way up from a fresh graduate to one of the most respected nurses in the emergency department. Just last month, she'd completed her advanced nursing degree, studying late into the night while balancing full-time work and family life. Her dedication showed in everything she did, from the gentle way she handled nervous patients to her precise attention to medical details. "Morning, everyone," she called out, setting her bag down at her station. The other nurses brightened at her arrival. They all knew having her on shift meant things would run smoothly. She had a way of keeping calm during chaos that made everyone feel more confident. But lately, things had been different. The atmosphere changed 2 months ago when Dr. Parker joined the staff. He was the newest addition to the medical team, and while his technical skills were impressive, his attitude towards certain staff members left much to be desired. As Nurse Thompson reviewed her patient charts for the day, she could hear Dr. Parker's voice carrying down the hallway. He was talking loudly about a diagnosis he'd made the previous day, making sure everyone within earshot knew about his brilliant catch. She took a deep breath and focused on her work, double-checking medication orders and reading through overnight notes. "I see you're on my rotation today," Dr. Parker's voice suddenly came from behind her. Without looking up, she could picture the dismissive expression on his face. She'd seen it often enough. Try to keep up with the proper procedures this time. The comment stung, but she kept her composure. "I've reviewed all the cases, doctor. Mr. Chen in 204 showed improved vitals overnight, and Mrs. Rodriguez in 210 is ready for her morning assessment." Her voice remained steady and professional despite the unnecessary jab. A few nearby nurses exchanged knowing looks. They'd all witnessed similar interactions over the past weeks. Despite Nurse Thompson's incredible track record and recent advanced certification, Dr. Parker seemed determined to undermine her at every turn. She gathered her supplies for morning rounds, her mind drifting to the letter of recommendation her previous supervisor had written for her advanced degree application. "One of the finest nurses I've had the privilege to work with," it had said. "Her clinical judgment is exceptional, and her patient care is outstanding." The morning huddle was about to start, and Nurse Thompson knew she'd face more of Dr. Parker's thinly veiled comments. But she also knew something he didn't, that today's patients included someone who might just change everything. She straightened her scrubs, checked her equipment one last time, and headed to the meeting room. Whatever challenges lay ahead, she would face them with the same grace and professionalism she'd shown throughout her career. As she walked down the corridor, she couldn't help but smile slightly, thinking about the patient in room 315. Sometimes life had a way of teaching important lessons to those who needed them most, and today might just be one of those days that would be remembered long after the shift ended. The morning rounds were going smoothly as Nurse Thompson made her way to room 315. The patient there, Mrs. Brooks, was recovering from hip surgery and had been nothing but pleasant since her arrival 3 days ago. There was something dignified about the elderly woman, from her perfectly styled silver hair to the way she spoke with such thoughtful consideration. "Good morning, Mrs. Brooks," Nurse Thompson called out cheerfully as she entered the room. "How are you feeling today?" She noticed the crossword puzzle book on the bedside table. Her patient had mentioned being a fan of brain teasers to keep her mind sharp. "Much better, dear," Mrs. Brooks replied, folding her reading glasses and setting them aside. "That pain medication schedule you worked out has made all the difference." She adjusted herself carefully in the bed, her movements more confident than the day before. Nurse Thompson began her usual morning checks, her experienced hands gentle as she took vital signs. "Your blood pressure is looking much better today," she noted, recording the numbers in her tablet. "And your temperature is perfect. How's your pain level on a scale of 1 to 10? "About a 3 now," Mrs. Brooks answered thoughtfully. "Down from yesterday's 5. I can tell I'm healing." She watched as the nurse efficiently checked her IV line and adjusted her pillows for better support. That's excellent progress. Nurse Thompson smiled, beginning to explain the day's medication schedule. We'll continue with the current pain management plan since it's working so well. The physical therapist will be coming by after lunch though. The door swung open abruptly, cutting her off mid-sentence. Dr. Parker strode in, not looking up from his phone. The atmosphere in the room shifted instantly, like a cloud passing over the sun. I'll handle the patient assessment, he announced, still not making eye contact. You can go handle the simpler tasks. His dismissive tone hung in the air like a heavy curtain. Nurse Thompson maintained her professional composure, though her hands tightened slightly around her tablet. I was just explaining to Mrs. Brooks about her improved vital signs and... I'm sure you think you were doing a fine job, Dr. Parker interrupted, finally looking up with that familiar condescending smile. But let's have someone more qualified handle the important details. We wouldn't want any mistakes. Mrs. Brooks's eyes narrowed slightly as she observed the interaction. Most people might have missed the slight straightening of her shoulders or the way her fingers smoothed the blanket, a habit from years of maintaining composure in tense situations. Doctor, Nurse Thompson began steadily, I've been monitoring Mrs. Brooks's progress closely, and there are some important observations about her recovery pattern fat. When I want a nursing opinion, I'll ask for one, Dr. Parker cut in sharply. Why don't you go check if anyone needs their pillows fluffed? He turned his back to her, effectively dismissing her presence. What Dr. Parker failed to notice was the way Mrs. Brooks's expression changed, the slight tightening around her mouth, the calculating look in her eyes. She'd spent decades recognizing these subtle forms of discrimination, first as a young professional herself, then watching her son battle against such behavior in courtrooms across the state. Nurse Thompson gathered her materials, maintaining her dignity despite the doctor's behavior. As she turned to leave, Mrs. Brooks spoke up, her voice carrying the kind of authority that comes from years of experience. Nurse, she called softly, thank you for your thorough care this morning. I'd like to make a note of your observations for my personal records, if you don't mind. The request seemed innocent enough, but there was something in Mrs. Brooks's tone that made Dr. Parker glance up briefly. The elderly woman was writing something in a small notebook she kept beside her bed, her handwriting precise and deliberate. As Nurse Thompson left the room, she couldn't help but notice Mrs. Brooks's gentle smile, the kind of smile that suggested she knew something others didn't. The kind of smile that hinted at changes to come. Outside in the hallway, other staff members who had overheard the interaction exchanged knowing looks. They'd witnessed similar scenes before, but something felt different this time. Maybe it was the way Mrs. Brooks had watched everything unfold, or perhaps it was the quiet confidence she exhibited despite being a patient in a vulnerable position. Little did Dr. Parker know, his behavior that morning was being carefully documented by someone who understood far more about professional conduct and justice than he could imagine. Sometimes the most important lessons come from the most unexpected teachers, and room 315 was about to become a classroom none of them would soon forget. Later that morning, the real confrontation unfolded in front of the nursing station. Nurse Thompson was carefully reviewing the latest lab results for Mrs. Brooks when Dr. Parker approached, his footsteps heavy with purpose. The other staff members nearby could sense the tension building, like storm clouds gathering before rain. I need to discuss your so-called assessment of the patient in 315, he announced loudly, making no effort to keep his voice down. Several other nurses and a passing orderly slowed their pace, pretending to be busy with their tasks while watching the scene unfold. Nurse Thompson looked up from her work, her expression calm despite her racing heart. Of course, doctor. I documented all my observations in the patient's chart. She reached for the tablet to show him the detailed notes she'd made about Mrs. Brooks's recovery progress. Dr. Parker waved his hand dismissively. I've seen enough of your documentation to know it's barely adequate. His voice carried down the hallway, drawing more unwanted attention. You completely missed noting the slight swelling in her right ankle. With all due respect, Nurse Thompson replied steadily. I did note the minor edema on page 2 of my morning assessment. I've been tracking it since yesterday evening, and it's actually improved by 20%. The doctor's face flushed slightly. He hadn't bothered to read the full report. Rather than acknowledge his oversight, he pressed on, his voice growing louder. Well, you failed to mention the patient's complaints about pain during movement. That's not correct either, came a firm voice from behind them. Mrs. Brooks was there in her wheelchair, accompanied by a physical therapy assistant. She'd insisted on taking her morning walk, determined to stay on track with her recovery plan. Dr. Parker turned, clearly startled by the patient's presence, but quickly recovered his authoritative demeanor. Mrs. Brooks, you should be resting. And this discussion doesn't concern. Oh, but I believe it does, Mrs. Brooks interrupted, her voice carrying the weight of years of experience handling difficult situations. Nurse Thompson has documented everything meticulously. In fact, she's the one who developed the modified pain management schedule that's working so well for me. The doctor's expression tightened. With all due respect, Mrs. Brooks, you don't have the medical expertise to evaluate. I may not be a doctor, Mrs. Brooks cut in smoothly, but I know enough to recognize competence when I see it. And more importantly, I know enough to recognize when someone is being treated unfairly. By now, a small crowd had gathered, trying to appear busy while watching the scene unfold. The physical therapy assistant stood awkwardly beside Mrs. Brooks's wheelchair, unsure whether to continue their scheduled walk or wait. Dr. Parker's voice took on a patronizing tone. Mrs. Brooks, I understand you've developed a fondness for your nurse, but in matters of medical expertise. In matters of medical expertise, Mrs. Brooks continued firmly, one should rely on demonstrated competence rather than preconceived notions. She adjusted her reading glasses, looking at him with the kind of steady gaze that had made many people reconsider their actions over the years. Nurse Thompson stood quietly, maintaining her professional demeanor despite the doctor's attempts to undermine her. She'd faced similar situations before, but something felt different this time. There was a shift in the air, a sense that things were about to change. I've been taking notes, Mrs. Brooks continued, patting the small notebook in her lap. Fascinating observations about the various interactions I've witnessed during my stay here. My son, he's quite interested in workplace dynamics, you see, will find them very enlightening. Dr. Parker's expression flickered slightly at the mention of her son. I'm sure your son would agree that a doctor's medical judgment. My son, Mrs. Brooks interrupted once more, her voice taking on an edge of steel beneath its polite exterior, has spent the last 20 years ensuring that competence and merit determine a person's treatment in the workplace, not prejudice or bias. The silence that followed was heavy with understanding. Several staff members exchanged knowing looks. They'd all witnessed Dr. Parker's behavior over the past months, but this was the first time someone had so directly challenged it. Now, Mrs. Brooks continued pleasantly, as if she hadn't just delivered a carefully veiled warning. I believe I'm scheduled for my morning walk. Nurse Thompson, would you mind checking my vital signs before I continue? I'd value your thorough approach. As the physical therapy assistant began wheeling Mrs. Brooks away, she paused briefly. Oh, and Dr. Parker, my son will be visiting this afternoon. Perhaps you'd like to discuss your concerns about staff competency with him directly. He's always eager to learn about workplace dynamics in healthcare settings. The doctor stood there, his usual confidence visibly shaken as Mrs. Brooks was wheeled away. The gathered staff slowly dispersed, but the impact of what they'd witnessed lingered in the air. Sometimes the most powerful moments of change come not from grand gestures, but from someone finally having the courage and the position to speak truth to power. While Dr. Parker retreated to his office to gather his thoughts, Mrs. Brooks sat in the hospital garden during her physical therapy session, her small notebook open on her lap. The morning sun warmed her face as she looked through her careful observations from the past 3 days. As a former nurse herself, she knew exactly what to watch for, what details mattered most. Would you like to rest a bit longer? The physical therapy assistant asked, noticing how Mrs. Brooks was deep in thought. Just a few more minutes, she replied, her pen moving steadily across the page. You know, I spent 30 years in healthcare myself. Started as a nurse right after the civil rights movement. She paused, looking up at the young assistant. Things were different then, but some struggles, well, they haven't changed as much as they should have. She flipped through her notebook, past pages filled with times, dates, and detailed descriptions of interactions she'd witnessed. Not just with Nurse Thompson, but with other staff members too. A pattern had emerged, clear as day to her experienced eye. My son doesn't know I've been doing this, she confided, adjusting her reading glasses. He thinks I'm just here recovering from hip surgery. But mothers never really stop protecting others, do they? She smiled warmly at a passing nurse who had been kind to her during her stay. The truth was, Judge Brooks had been building a case about systematic discrimination in healthcare for months. What he didn't know was that his mother's routine hip surgery had turned into an unexpected opportunity to gather first-hand evidence. Back in her room, Mrs. Brooks carefully documented the morning's confrontation. Her handwriting, still elegant after all these years, filled another page with observations about body language, tone, and specific phrases used. Her years of experience in nursing had taught her the importance of detailed documentation. Lunchtime, Mrs. Brooks called a friendly voice as one of the kitchen staff entered with her meal tray. "I brought you an extra Jell-O cup today." "Thank you, dear," she responded warmly. As she ate her lunch, she thought about how the hospital had changed since her days as a young nurse. The equipment was certainly more advanced, the treatments more sophisticated, but some of the old challenges remained stubbornly in place. She remembered her own struggles, the barriers she'd faced, the dismissive attitudes she encountered. Back then, she had to stay quiet, to keep her head down, and work twice as hard for half the recognition. But now, watching history repeat itself with Nurse Thompson, she found herself in a unique position to do something about it. Her son's work as a civil rights judge had opened her eyes to how documentation and testimony could create real change. Every note she'd taken, every interaction she'd recorded, was another piece of evidence that couldn't be ignored or dismissed. As she finished her lunch, she heard Dr. Parker's voice in the hallway, speaking to someone about patient care protocols. She noticed how his tone had changed since the morning's confrontation, slightly less confident, more careful in his choice of words. The small notebook on her bedside table was having its effect, even before its contents were revealed. A knock at the door interrupted her thoughts. It was Nurse Thompson coming to check her vital signs again. Mrs. Brooks watched how professionally she carried herself, despite everything that had happened that morning. It reminded her of her own days in nursing, how she'd learned to maintain dignity in the face of disrespect. "Your son called the nurses' station," Nurse Thompson mentioned while taking her blood pressure. "He'll be here in about an hour." Mrs. Brooks nodded, patting her notebook. "Perfect timing," she said softly. "You know, dear, sometimes the most important cases aren't the ones you go looking for. Sometimes they find you when you least expect it." She thought about her son, about how proud she was of his work fighting for equality and justice. He didn't know it yet, but his next big case was sitting right here in his mother's hospital room, documented in her careful handwriting, waiting to make a difference. As the afternoon sun cast long shadows through her window, Mrs. Brooks reviewed her notes one last time. Years of experience had taught her that change often came from unexpected places. Sometimes it took someone with the right combination of knowledge, position, and determination to shine a light on long-standing problems. And sometimes that someone turned out to be a patient in room 315, armed with nothing more than a small notebook and a lifetime of experience in recognizing injustice when she saw it. The afternoon sun cast long shadows through the hospital windows as a distinguished-looking man in a perfectly pressed suit walked through the main entrance. His presence commanded attention without seeking it, the kind of quiet authority that came from years of standing up for what's right in courtrooms across the state. Judge Brooks made his way to the elevator, his briefcase in hand. He'd planned this visit to check on his mother's recovery, but her phone call earlier had hinted at something more. He knew his mother well enough to recognize when she had something important to share. As he stepped out onto the fourth floor, he heard a familiar voice, Dr. Parker's distinctive tone carrying down the hallway. The doctor was speaking to Nurse Thompson again, his words dripping with condescension. "I don't care how long you've been here," Dr. Parker was saying, his voice echoing in the corridor. "When I give instructions about my patients, I expect them to be followed exactly as given, not interpreted by nursing staff who think they know better." Judge Brooks slowed his pace, years of courtroom experience having taught him the value of observing unnoticed. He watched as Nurse Thompson held her ground professionally, despite the doctor's dismissive attitude. "Doctor, the protocol adjustment was necessary because of the patient's updated blood pressure readings," she explained calmly. "It's standard procedure, Toe." "Standard procedure is what I say it is," Dr. Parker interrupted, his voice rising. Or perhaps they didn't teach you that in whatever program you attended. The judge's eyes narrowed slightly. He'd seen this type of behavior before, too many times in too many places. As he watched, other staff members nearby kept their heads down, a clear sign this wasn't an isolated incident. "Is there a problem here?" Mrs. Brooks's voice suddenly cut through the tension. She had wheeled herself into the hallway, her small notebook visible in her lap. Judge Brooks couldn't help but smile. His mother had always had perfect timing. Dr. Parker turned, his expression freezing as he noticed Judge Brooks standing there. The doctor's face went through a rapid series of emotions: surprise, recognition, and then something close to worry. "Mom," Judge Brooks said warmly, walking over to embrace her. "I see you're making quite an impression on the staff." "Oh, you know me, dear," she replied, patting his hand. "I like to stay observant." She opened her notebook meaningfully. "In fact, I've been taking quite detailed notes about my stay here. Very interesting patterns of behavior to document." The color drained from Dr. Parker's face as understanding dawned. His eyes darted between mother and son, suddenly realizing the full implications of his actions over the past few days. "Dr. Parker," Judge Brooks said smoothly, "I've been looking forward to meeting you. My mother has mentioned you several times in our phone conversations." He paused significantly. "She's been quite thorough in her observations." Nurse Thompson stood quietly, watching as the situation unfolded. Other staff members had gathered at the edges of the scene, sensing that something important was happening. I have other patients to attend to," Dr. Parker stammered, trying to retreat. "Actually," Mrs. Brooks interjected, "I think we should all have a conversation. My son is particularly interested in workplace dynamics and professional conduct in healthcare settings." She smiled, but there was steel behind her gentle expression, especially when it comes to ensuring equal treatment and respect for all medical professionals. Judge Brooks opened his briefcase, removing a small recorder. "I'd very much like to document this discussion, if you don't mind. For the sake of accuracy, of course." The hallway had grown very quiet. Years of accumulated frustration and unspoken words hung in the air as Dr. Parker realized his position. The power dynamic had shifted completely, and his usual tactics would no longer work. "Perhaps we should take this discussion somewhere more private," Judge Brooks suggested, his tone making it clear this wasn't really a suggestion. "I believe the conference room is available." He turned to Nurse Thompson. "Would you be willing to join us? Your perspective would be valuable." As they made their way to the conference room, other staff members exchanged meaningful looks. They'd all witnessed similar behavior from Dr. Parker over the months, but now, finally, something was being done about it. Mrs. Brooks wheeled herself alongside her son, her notebook open on her lap. Sometimes justice needed a little help to find its way, and sometimes that help came from unexpected places, like a patient in room 315 who happened to be both a former nurse and the mother of a civil rights judge. The next morning, the hospital's administrative office was buzzing with activity. Word had spread quickly about the meeting in the conference room, and now the hospital board had called an emergency session. The large conference room on the top floor was filled with board members, all wearing serious expressions as they reviewed the evidence before them. "These notes are incredibly detailed," the chief of medicine said, carefully turning the pages of Mrs. Brooks's notebook. Dates, times, specific interactions, all documented with the precision of someone who understands healthcare protocols. He looked up at the other board members gathered around the table. The hospital's HR director cleared her throat. "We've actually received similar complaints before, but never with this level of documentation." Mrs. Brooks's nursing background gave her unique insight into what to watch for and record. In his chair at the end of the table, Dr. Parker sat quietly, his usual confidence completely deflated. The evidence was overwhelming. Not just Mrs. Brooks's careful documentation, but other staff members had finally felt safe enough to come forward with their own experiences. "This isn't just about one doctor's behavior," Judge Brooks explained, standing at the front of the room. "This is about creating a workplace where every healthcare professional is respected for their expertise and contribution to patient care." The board members nodded in agreement. They'd spent the morning reviewing not just the recent incidents, but patterns of behavior that stretched back months. The picture it painted was clear and demanded action. We have a responsibility, the hospital's chief of staff added, not just to our staff, but to our patients. Quality healthcare depends on teamwork and mutual respect among all medical professionals. Outside the conference room, the hospital continued its daily routines, but there was a sense of anticipation in the air. Staff members went about their duties, stealing glances at the closed conference room doors, wondering what changes would come from this meeting. Nurse Thompson was in the middle of her morning rounds when she was called to the administrative office. As she walked down the hallway, other nurses gave her encouraging smiles. They all knew this day would bring changes. In the office, the hospital administration had prepared a formal apology. But more than just words, they presented a comprehensive plan for change. Dr. Parker would be required to complete an extensive professional development program focusing on workplace respect and collaborative healthcare practices. We're also implementing new hospital-wide policies, the HR director explained. Clear guidelines about professional conduct with real consequences for discriminatory behavior. She paused, looking directly at Nurse Thompson, and we want you to be part of the committee that oversees these changes. Dr. Parker was placed on supervised practice, his interactions with staff to be closely monitored over the coming months. The arrogant demeanor that had characterized his previous behavior was gone, replaced by a sobering understanding of how close he'd come to destroying his career. Later that afternoon, Mrs. Brooks sat in her hospital room, packing her things for discharge. Her recovery had gone well, but her impact on the hospital would last long after she left. Her son sat beside her, helping to gather her belongings. "You know, Mom," Judge Brooks said with a smile, "when you told me you were having hip surgery, I didn't expect you to uncover a landmark workplace discrimination case." Mrs. Brooks chuckled, carefully placing her notebook in her bag. Sometimes the best way to create change is to be in the right place at the right time, with open eyes and a ready pen. As word spread through the hospital about the changes being implemented, there was a palpable sense of relief among the staff. Years of unspoken frustration were finally being addressed, and real change was happening. The hospital board didn't stop with just this case. They began a thorough review of all departments, looking for any similar patterns that needed to be addressed. Training programs were updated, reporting procedures were simplified, and most importantly, a new culture of respect began to take root. "It's amazing," one nurse commented to another as they watched the changes unfold, how one patient's courage to speak up could create such a ripple effect. Indeed, Mrs. Brooks's careful documentation had done more than address one doctor's behavior. It had sparked a transformation in the entire hospital's approach to professional respect and equality. Sometimes the biggest changes start with the smallest actions, like a patient in room 315 deciding to take notes about what she observed. 3 months after Mrs. Brooks's stay at Metropolitan General Hospital, the changes she helped spark were in full bloom. The morning sunlight streamed through the windows of the newly established Professional Development Center, where Nurse Thompson was leading a training session for incoming medical staff. "Healthcare isn't just about medical knowledge," she explained to the attentive group before her. "It's about working together, respecting each other's expertise, and putting patients first." Her confidence had grown even stronger in her new role as the head nurse of her unit and a key member of the hospital's diversity committee. Down the hall, Dr. Parker was having a very different kind of morning. After completing his mandatory sensitivity training and professional development courses, he'd emerged a changed person. Today, he was actually working alongside nurses, actively listening to their input about patient care. "I think we should adjust the medication schedule," a newer nurse suggested during rounds. In the past, such a suggestion might have been met with scorn. But now, Dr. Parker paused thoughtfully. "That's a good observation," he responded, surprising some of the staff who remembered his previous behavior. "Let's review the patient's chart together and work out the best approach." The change in his attitude wasn't just for show. He'd learned valuable lessons about teamwork and respect the hard way. In the hospital's main lobby, a new plaque hung on the wall, outlining the institution's commitment to equality and professional respect. Below it, a suggestion box invited staff to report both concerns and positive examples of collaborative care. It wasn't just decoration. The hospital administration reviewed these submissions weekly. Mrs. Brooks, now fully recovered from her surgery, had become a regular guest speaker at healthcare conferences, sharing her unique perspective as both a former nurse and a patient who helped expose workplace discrimination. Her small notebook had grown into a powerful presentation about recognizing and addressing bias in healthcare settings. Change doesn't always come from big gestures, she often told her audiences. Sometimes it comes from small acts of courage, from speaking up when you see something wrong, from documenting the truth even when others might prefer to ignore it. Her son, the judge, had used the case to help other hospitals review and improve their workplace policies. What started as one mother's careful observations had grown into a movement for positive change across the healthcare system. Back at Metropolitan General, the afternoon shift change was a different scene from 3 months ago. Nurses and doctors collaborated openly, sharing observations and concerns without fear. The hierarchy still existed, it had to in medicine, but it was now based on expertise and experience rather than prejudice or power plays. We've seen a 30% increase in staff satisfaction, the HR director reported during a board meeting. And patient outcomes have improved too. When healthcare professionals feel respected and heard, everyone benefits. The story of what happened in room 315 had become something of a legend among new staff members. Not as gossip, but as a reminder that every person's dignity matters, that expertise comes in many forms, and that real change is possible when people stand up for what's right. Nurse Thompson's office, now adorned with her advanced certification and leadership awards, had become a safe space for staff members seeking advice or support. The photo on her desk showed her with Mrs. Brooks at a recent healthcare conference, both women smiling proudly at the camera. "You know what the best part is?" she told a colleague one day. "It's not just about stopping bad behavior. It's about creating an environment where everyone can do their best work, where every healthcare professional feels valued, and where patients get the best possible care." In the hospital cafeteria, nurses and doctors now sat together, sharing meals and discussing cases. The invisible barriers that once divided the staff had melted away, replaced by a culture of mutual respect and collaboration. And Dr. Parker? He'd become an unexpected advocate for change, speaking openly about his past mistakes and what he'd learned. "I thought being a good doctor meant always being right," he admitted during a staff meeting. "Now I understand that true excellence in healthcare comes from working together, from respecting each other's knowledge and experience." As the sun set on another busy day at Metropolitan General, the evening shift arrived to find their colleagues waiting to share important patient updates. Nurses and doctors working side by side, each voice valued, each observation considered. In room 315, now occupied by a new patient, the spirit of Mrs. Brooks's quiet revolution lived on, a reminder that sometimes the most powerful changes start with one person willing to stand up for what's right.